Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today we have with us Dr. Gurbakhash Kaur, who is assistant professor at one of the leading myeloma programs in the country, Icahn School of Medicine at Mount Sinai in New York. And she presented some of the data at the European Hematology Association meeting that was just concluded that caused a lot of attention and created quite a stir. So I'm glad to have her here to talk about her research. Welcome, Gurbaksh.
Thank you, Dr. Vij.
So this was a study of what we call Anitocabtagene in relapsed refractory myeloma, the Imagine-1 study. So for our audience, could you just give us a little primer on how this differs from the two currently commercially available CAR-Ts, Abecma and Carvykti?
Sounds good. So Anitocabtagene is also targeting BCMA like Carvykti and Abecma, but what is different about it is that it has a novel binding domain called the D domain. And the uniqueness of these D domains are that they're very stable. They bind to the target very efficiently, but also able to release very quickly. So what we think how that translates into clinical practice is that you're able to see deep and durable remissions with this CAR T without the toxicity.
So I understand that before the trial that you presented, there has been one other trial done and reported. So could you just, for the audience, tell us what we know about this drug so far?
So we were able to share the updated data follow-up of the phase 1 portion of the study, which demonstrated a median progression-free survival of 30.2 months in a heavily pretreated patient population. And then also we were able to see 79% of patients achieve a complete response or better. The median overall survival was not reached. And what was also unique was that the patients who had deep responses, their PFS was also longer by a couple of months, 34.3 months. It had similar efficacy and durability in terms of their remission, even in the high risk features. And you know what those are, right? The high risk EMD, high risk cytogenetics. And the key thing is that this, with the long-term follow-up, 38.1 month follow-up, we saw no non-icons related toxicities such as Parkinsonism, cranial nerve palsies, or Guillain-Barré in the study.
So now coming to the main presentation of the data that you got to present. So could you tell us about the trial here?
So this is your typical phase 2 study design of a CAR T study. In this study, we enrolled patients who had prior IMiD, PI, and CD38 targeted therapies already. They had to be refractory to their last line.